Hi, my name is Dr. James Rota, and I'd like to demonstrate some of the features of what we're referring to as the Bouncercise system. As you know, I've used Bouncercise as a means of activating the lymphatic system in my body, and over the years I've bounced using a rebounder of various shapes and sizes, and we developed our own after years of experience of bouncing or jumping and then really determining the objective, and that is the exercising of the lymphatic system. A gentle bounce seems to be a perfect or a suitable way of activating our lymphatic system safely for all age groups. When we're children, we don't have to be urged to bounce. Children will bounce on their own. As we get older, we have a tendency to become more rigid in our movements if we move at all. And therefore, we're beginning to see the byproducts of the reactions of the toxic byproducts that are the result of no moving. No moving causes an interruption in metabolism and toxic byproducts that makes us get old. So the objective is movement, and so the development of the Bouncercise system is where we've taken an upper body support system, we're calling it, whether it's from the ceiling or the doorway or in this case the wall, to give us a secure bounce. So I can start out with a suitable bouncing surface that will withstand various weights, and not so much to propel, but to bounce, a gentle bounce to give the body's lymphatic system an opportunity to release, to facilitate the release of the toxic byproducts of the cells and the reception of the nutrients for the health of those cells. So, demonstrating Bouncercise by the utilizing of an upper body support system that I could attach a lot of bungee cords that can be utilized while bouncing, because there appears to be a synergistic effect that when you move the body in an aerobic way and also use muscles to stretch and to circulate, there's an acceleration in fat loss, which the YMCA studies have revealed, but mostly being able to accelerate the development of those muscles, especially in the various athletic movements. I know for me, when I was testing my manhood by throwing the javelin in the Senior Olympics, I trained by using these bungees as a means of exercising and develop those muscles that are required for that movement. And of course, this can be applied from everything from various physical movements in sports to the development of the legs, and of course the containment for the tummy. We are doing a lot to contain the tummy and to show off the muscles. What do you call it? The beer ripple effect. So again, where you have the muscles rippling or not, the objective of the muscles is to contain the tummy so it doesn't get carried away with consumptions. So I've been using this system to exercise the tummy muscles, because I could take the upper body support system and bounce in an inclined way so that my abdominal muscles are working now, and not just working statically, but I develop more muscle fibers, a hyperplasia of the muscles, as opposed to just letting the muscle fibers swell up. Hypertrophy, as in weightlifting, static forces, as in the barbell dumbbell concept, where you're exercising the muscles in a variable way, variable angles, because the muscle cell can only contract. So if you're going to contract in a certain varying direction, you're going to make more cells. You're going to have more dense fibers. So again, the ability to Bouncercise in an inclined way, as I'm doing now, can activate those abdominal muscles as well as the glutes, the gluteus maximus muscles, the bun muscles. We all seem to like and respect nice buns. Well, the foundation for the buns are the gluteus maximus muscles. So if you want to accentuate what's on top of it, develop what's underneath it. So the gluteus maximus, stimulated in an inclined fashion as I'm doing now, can keep my 80-year-old buns in shape. Anyway, today, bounce your way to health.